Welcome back. In today's session, we will discuss another homeopathic remedy called Mercurius solubilis. The common name of Mercurius solubilis is quicksilver. It is proved by Dr. Hahnemann. The source of Mercurius is mineral kingdom. It is the element Hg. So we see Mercurius solubilis is nothing but quicksilver represented by the symbol Hg. Mercurius is the king of anti-syphilitic remedies. So we see it is a great anti-syphilitic remedy, also known as the king, the top remedy for syphilitic conditions. So it is a great anti-syphilitic remedy. Moving further to the sphere of action, every organ and tissues of the body is more or less affected by the powerful drug. The more important parts of the body where the Mercurius acts is the bones, glands, lymphatic system. We see it acts on the bones, it acts on the glands, various types of glands we have here. It acts on the glands, lymphatic system, mucous membrane of the intestines, and we have the other internal organs like heart, lungs, and so on. Let us begin with the pathogenesis. What does Mercurius do in the body? It will produce lesions are produced by the mercury. It will produce the lesions which are very similar to those of syphilis. So we know the disease syphilis which causes chancres and ulcers. So the Mercurius will also produce ulcers which are similar to that of the syphilis. It will decompose the blood, producing profound anemia in the patient. So it causes decomposition of the blood, setting up anemia. It has a power over suppuration. It has a great power over suppuration with a serosanguinous discharge and also slimy in character. So let us assume here. So this is having so you can see the ulcer here which is quite suppurated, and also if there is a serosanguinous blood tinged discharge, if there is a blood tinged discharge which is slimy in character, we have to think of Mercsol. It also produces ulcerations of the mouth. So we saw the lesions which are similar to those of syphilis. Also the ulcerations of the mouth and throat are also produced by Mercsol. There is much salivation with a falling off of hair. So guys, we see we are studying about the destructive nature. It is an anti-syphilitic remedy. So obviously it will produce symptoms which are syphilitic in nature. What do you mean by syphilitic? Which is destructive in nature. So the ulcers are also very destructive. There is phagedenic ulcers. There is falling off of hair and much salivation. It causes inflammation which is later on leading to induration. There is induration to ulceration, and from ulceration there is induration. So we see induration is nothing but the hardening. You can see in cases of malignant cases there is hardening. So it is the ulcerations can then be indurated. They can turn to be malignant. They can be very hardened. Okay. How is the physical makeup of the patient? It is suited to light-haired people who have lax skin and lax muscles. You can see the skin as well as the muscles very lax in the patient. So Mercsol or quicksilver, okay, Mercurius solubilis is suited to the people who have this lax skin and muscles. In some cases, jaundice or yellowish discoloration of the skin is marked. So when there is jaundice, the yellowishness, you can also see this yellow sallow skin. There is yellowish discoloration of the skin is also observed. Temperament, they are easily frightened in nature, hurried and rapid speech. They are very frightened, easily they get frightened, easily startled, and they have this hurried and rapid speech. They speak very fast, hurried and rapid speech. The miasm, so we know it is a great anti-syphilitic remedy. So the miasm obviously is going to be syphilis. It is a king of anti-syphilitic remedy. Which is the king of anti-syphilitic remedies? That is Mercurius solubilis, Mercsol. The relation with heat and cold, Mercurius is said to be a human barometer. So we see two key points we are getting. It is a king of anti-syphilitic remedies. It is said to be a human barometer. Human barometer because it is easily affected by the extremes of heat and cold. Whereas antim crude is least affected. Okay, sorry, antim crude is also affected by the extremes of heat and cold. Least affected is fluoric acid. So guys, we see the human barometer, they are easily affected by the extremes of heat and cold, similar like that of antim crude. And we have fluoric acid who is least affected by heat and cold. Moving further to the guiding symptoms. So the guiding symptoms of each remedy is very important. You need to focus a lot. Then in the particulars, the same points will be applicable. So all the complaints are aggravated from sunset to sunrise. You can see from the sunset to sunrise. We know like in the organon of medicine, we have studied about the miasm syphilis. What do we study? We call them sun worshippers. Why do we call them sun worshippers? Because the complaints get ameliorated with sunrise. As the sun rises, the complaints come down. Whereas the complaints are being aggravated at night in cases of syphilitic miasm. So since the Mercurius has syphilis in the background, all the complaints will be aggravated from sunset to sunrise, and whole night they will have aggravation of the complaints. Especially the bone pains, they will become very severe at night. This is the characteristic symptom in cases of the syphilitic medicines. All the syphilitic medicines, we know whenever there is syphilis miasm in the background, we have aggravation at night from sunset to sunrise, the whole night aggravation. We also have this characteristic discharges, which we'll be discussing in detail in the next slides. So the profuse offensive perspiration. How is the perspiration in Mercurius? It is profuse in quantity, large quantity. Profusely they sweat and very offensive perspiration is seen. Nearly in all the complaints, which gives no relief to the patient. This perspiration, the natural discharge perspiration, gives no relief in cases of syphilis. On the contrary, the natural discharge like perspiration is increasing the suffering. So you can relate to your organon when we study the theory of chronic miasms and all such miasmatic description which is given by the great stalwarts. We see that they have said the complaints of syphilis are not relieved by natural discharges. So the sora on the other hand will be relieved. Here they are saying that it gives no relief to the patient because it is syphilis. Perspiration gives no relief. Profuse perspiration gives relief in cases of natremure and sorinum. All the discharges are offensive, especially we saw the sweat. Perspiration was very offensive. Even the breath is going to be offensive. You can see the patient here. The breath is being very offensive. The patient as a whole will smell offensive. Foulness and offensiveness is running through the whole remedy. The tremors and trembling from the least exertion. So we have the tremors and trembling from the least exertion, especially in the nervous disorders like paralysis agitans. Paralysis agitans is nothing but the Parkinsonism in today's modern terminologies. In the older terms, they used to term it as paralysis agitans. In paralysis agitans, we have this tremors and trembling which is initiated from the least exertion. Creeping chillness with the fever is also a peculiarity of this drug. There is chillness along with the fever, which is a very creeping chillness with the fever is the peculiarity of this drug. The discharges from the mucous membrane are slimy in character. You can see all the discharges from the mucous membrane are very slimy in character. The thirst, Mercurius has an intense thirst for large quantities of cold water. Although the tongue is moist, it is salivated, it is large and flabby, showing the imprints of the teeth. They have intense thirst. Even though the tongue is moist and salivated, in spite of the moistness of the tongue, there is great intense thirst for the large quantities of cold water. And the tongue will show the imprints of the teeth. We see it is large and flabby, and all the teeth imprinted on the tongue. You can see in the picture, so beautifully given. Then thanks to this Google Images for making our understanding so beautiful. So we see that there is imprints of the teeth which are shown on the tongue. We also have this symptom exhibited in the other drugs like chelidonium, podophyllum, rustox. The dry tongue with no thirst in cases of pulsatilla. If they have a dry tongue along with absence of thirst, no thirst, thirstless is pulsatilla. Nux moscata is thirstless. Dry tongue with much thirst is bryonia and arsenic. We know bryonia have a large quantities of cold water at long intervals. So the dry tongue with a much thirst is bryonia and arsenic. So guys, we are also studying the comparisons here, which will help us a lot. Also, it will help you fetch more marks in your examinations. So what did we study? The tongue will be moist. They have thirsty. They have the thirst for cold water is Mercsol. If they have dry tongue and no thirst, then pulsatilla and nux moscata. Dry tongue along with the thirst is bryonia and arsenic. Every little injury suppurate. So which are the other drugs where we see that every little injury is turning into suppuration? The pus formation occurs. So we have this in heparcel, silesia and graphitis. We see that every little injury will turn into a suppurative state. Mercsol has glandular swellings with or without suppuration. So we see that here the glandular swelling, it is present along with the suppuration. The glandular swelling could be present with or without suppuration, especially if the suppurative discharges are too profuse and offensive. And if the suppurative stage is present, the suppuration is also going to have a profuse discharge, and the suppuration is very offensive. The discharges are going to be profuse and offensive. Clear, guys? What are the desires? Mercsol desires for milk, sweets, wine, alcohol, and it has aversion to meat, coffee, tobacco, and meat, coffee, butter. They have aversion to all this. Moving further to the mental symptoms of Mercsol. They are tired of life. Mercsol patients are tired of the life. They have a weak memory, loss of willpower. They don't have that willpower, okay? To if they fall sick, they should have for anything. We want the willpower to perform any act, to achieve a goal, to carry on our life. We want the willpower to perform an act. So here they are lacking the willpower. They are weak memory. They have this weak memory. Slow and sluggish in answering questions and fear of losing his reason. So we see the Mercsol, it is the formula we see, it is belonging in the periodic table in such a constituent that it lacks the structural stability. It is losing, they have that fear of losing the bond. Similarly, the Mercsol also has his fear of losing his reasoning. Mercury has a fear of losing its structural stability in the periodic table. When we apply that here, they have this reason losing the reason. They have a fear that they are going to losing his reasoning, and they have a great apprehension, desire to flee. They have a desire to just run away because of this nightly anxiety. They just want to flee, run away from there. Bad effects of fright and mania. They throw off the clothes at night and start scolding. So you can see this woman here, she's maniac, she's throwing off the clothes and she starts scolding people around her, but she does not harm anyone. Disgust for life. Even though they are syphilitic, they are not reaching to such an extent that they will harm others. They are just throwing the clothes at night, scolding the people around them, and they have the disgust for life. Tired of life, disgust for life, weak memory, fear of losing their reason, and great apprehension. They have this desire to run away at night because of the anxiety. They throw the clothes at night, scold the people around them, and abuse them, but they don't harm anybody. Ailments from abuse of crude mercurial preparation. When the mercurial preparations are given in a crude form, because of the crude mercurial administration, the complaints can arise. Bad effects of sugar. So we saw the ailments from our sweets, that is sugar. Stings of insects, fright, suppressed foot sweat. Okay, we have the sting of insect, fright, the suppressed foot sweat if it is suppressed. Vapor of arsenic or copper, suppressed gonorrhea or syphilis. So we see the complaints are arising because of the suppressed gonorrhea. If the gonorrhea is suppressed, it is later on manifesting. In the third stage, it affects the internal organs. So when we see the particulars, we can relate. If the gonorrhea is suppressed, then it can result in the manifestations, which are various manifestations of the internal organs. In the liver and the lung complaints, there is utter inability to lie on the right side. If they have the liver affection or the lung affection, Mercosol cannot lie on the right side. There is aggravation when the patient is lying on the right side, and the symptoms will get worsened by touch and pressure. So we see the symptoms are getting worst by touch and pressure, and it is indicated in the suppurative stage of smallpox. It is a specific remedy. You can see in the picture here, Mercosol is a specific remedy for, it is a specific remedy for smallpox. It is a specific remedy for smallpox. And a specific remedy for smallpox, which stage of smallpox? In the suppurative stage of the smallpox. Clear, guys? In the suppurative stage of the smallpox, the Mercosol is a specific remedy. Flow of the pus, especially the serosanguinous, that is bloody pus from any orifice, is calling for the Mercurius solubilis. Moving further to the particulars of this drug. Mouth symptoms. How is the taste in cases of syphilis? They have this bitter putrid taste in the mouth, right? Metallic coppery taste. So in the mouth there is bitter taste, sweetish, putrid, slimy, metallic, coppery, soapy, stringy, tenacious mucus. So we see here there is soapy, stringy, tenacious mucus, small, scanty mucus with intense thirst and foul breath. We know the mouth, there is foul breath from the mouth. There is intense thirst. All of these points from the guiding symptoms we know. There is intense thirst. There is a foul smell from the mouth. And the discharge or the mouth, the saliva will be stringy, tenacious mucus. There is metallic, coppery taste, putrid, slimy, sweetish, bitter taste in the mouth. And the saliva is profuse and offensive. Tongue is swollen, flabby, taking the imprints of teeth. We also had the other drugs like chelidonium and so on. They are coated brown or black, thickly coated dirty yellow in cases of jaundice. In cases of jaundice, the discoloration of the tongue is going to be thickly yellow. May have painful ulcers. Teeth, toothache. What is the character of toothache? It could be pulsating, tearing, lacerating, shooting to the face or ears. The toothache, the pain is shooting to the face or ear. And the toothache, what is the character of toothache? Pulsating, tearing, lacerating, shooting. And it is shooting to the face, or the toothache is shooting to the ears. The toothache is aggravated in damp weather or evening from the warmth of the bed. You can see it is aggravated in damp weather. The toothache is aggravated in damp weather, evening, from warmth of bed, from extremes of heat and cold, but it is relieved by rubbing the cheeks. The patient feels relief by rubbing the cheeks. You see, she is rubbing the cheeks. She feels better. The toothache feels better by rubbing the cheek. Gums are swollen, painful, sore and ulcerated. They are swollen, they are painful, sore and ulcerated. The gangrenous gums with the bleeding on the least touch. These gangrenous gums will start to bleed from the least touch. They start bleeding. They are swollen, painful and sore. Okay. Thirst. Although the tongue is moist and salivated, there is intense thirst. We have studied this in the guiding symptoms. Dysentery. What is the causation of dysentery in Mercosol? The fright, the suppressed foot sweat is the cause for dysentery. The character of the stool is going to be slimy, bloody, very offensive stool, which is excoriating the anus. More the blood, the better is the Mercurius. The more the blood is discharged in the stools or excreted, they feel better. The more the blood, abnormal discharge, like blood, it is an abnormal discharge from the body, so the patient feels better in cases of abnormal discharges in syphilis. So more the blood, the better the patient is. Cannot finish sensation, the tenesmus, we see that they don't have that satisfactory sensation of passing the stools, and this tenesmus is not relieved even after stools, whereas in nux vomica they have the temporary relief after passing stools. Modalities, the complaints are aggravated at night. Concomitants, there is colic and fainting with a creeping chilliness and thirst. We see there is creeping chilliness, thirst, tenesmus during and after colic. Along with the colic, the patient faints. Maximum tenesmus is seen in cases of Merc or even for passing the urine. So yesterday we studied about Merc or. We also revised this point comparing with Merc sol. What is the difference? In Mercor, there is increased tenesmus. Tenesmus is of both bladder and rectum. In Mercor, bladder, tenesmus of bladder plus tenesmus of rectum. Whereas in Mercurius solubilis, we have only tenesmus of rectum. Respiratory symptoms, nose, there is nasal catarrh with a much sneezing of a fluent, acrid, corrosive discharge. The discharges from the nose are very acrid, corrosive in nature. They have raw and ulcerated nostrils. We see the nostrils, just like in the mouth we have ulcers. They also have the nostrils which are ulcerated. There is acrid, corrosive discharges. Yellow green fetid pus like discharge. So we know in syphilis they have this yellow greenish putrid offensive discharges. Bloody discharge from the nostrils. Nasal bones are swollen. They'll be painful and very sore to touch. So even the nasal bones are swollen and painful. Obviously the complaints are aggravated at night and from damp weather. Moving further through the throat, it is best indicated in cases of tonsillitis and quinsy. So guys, we see the tonsillitis, inflammation of tonsils in the throat, and also quinsy. Quinsy is the peritonsillar abscess. In cases of the tonsillitis, peritonsillar abscess or quinsy, diphtheria, whenever there is a false membrane formation in the throat, laryngitis, pharyngitis, inflammation of larynx and pharynx. When there is a constant desire to swallow, Merck sol is indicated. So we see what are the throat symptoms: tonsillitis, peritonsillar abscess or quinsy. We have pharyngitis, laryngitis, diphtheria, and a constant desire to swallow. Uvula is also swollen and elongated, bluish, red swelling with a burning and putrid discharge. It is swollen, red in color, and red, it is bluish red with a burning putrid discharge. Also the discharges are profuse and offensive, and the saliva is also profuse and offensive saliva. Moving further to the pneumonia. So in the respiratory complaints, we saw the nose. In the nose, there was sneezing, corrosive discharges, or we saw the sneezing, catarrh with sneezing, corrosive discharges, yellow-green fetish pus-like discharge, bloody discharge, nasal bone is swollen, painful, sore. And throat complaints, we saw tonsillitis, quinsy, laryngitis, pharyngitis, diphtheria. Uvula was swollen, elongated, bluish red. There is swelling, burning, putrid discharges, profuse offensive saliva. Moving further to the pneumonia. Pneumonia late in the hepatization and resolution stages. So in the resolution stage of pneumonia or in the hepatization stage of the pneumonia, because of the pneumonia, the texture is similar to that of the liver. So we name it hepatization stage of the pneumonia. Because of the disease, the texture of the lungs will change like that of the liver. In the hepatization stage or in the resolution stages of pneumonia, Mercosol is indicated. And when the lower lobe of the right lung is affected, like in the bryonia, chelidonium, kalicarb and lycopodium, we have to think of Mercosol. Mercosol, what is the affection? What is the side? The lower lobe of the right lung is affected. Other remedies, bryonia. In the bryonia as well, the lower lobe of the right lung is affected. Chelidonium, kalicarb lycopodium. Kalicarb lycopodium. What is the character of cough? Dry fatiguing cough, which is coming in two paroxysms. So when the coughs are coming in two paroxysms, the patient coughs two. The two paroxysms, if the patient coughs, it is Mercosol. If there are three paroxysms, so what are the three paroxysms? So three paroxysms. In the three paroxysms, we have remedies like stannum met and cupromet. There is stitching pain which is extending to the back. Because of this pneumonia, we have a stitching pain which is running to the back. So the next remedy we'll be dealing is stannum metallicum. So the stannum met, we will revise it again. I will ask you the question, how many paroxysms stannum met? We see there are three paroxysms in cases of stannum met and cupromet. In Mercosol, it is two paroxysms. Cough with a yellow mucopurulent expectoration. How is the expectoration? Even in stannum met, the yellowishness is worth nothing. Similarly, in Mercosol, we have the yellow mucopurulent expectoration, which is mixed with blood. It is putrid, salty in taste with an offensive breath. Okay, we know all this. The characteristic discharge is same. The peculiarity of this drug is maintained also in the particulars. The modality is aggravation at night, warmth of bed when the patient is lying on the right side. In damp wet weather, there is inability of the patient to lie on the right side, like in bryonia, natremure, phosphorus, sulfur. The patient cannot lie on the right side. The complaints are aggravated when he is lying down on the right side because the lower lobe of the right lung is affected. On the affected side, if the patient lies down, he feels the complaints are aggravated. Concomitants, fever with there is severe chilliness running on the back, offensive non-relieving sweat, moist salivated flabby tongue with the imprints of teeth, and there is intense thirst. Okay, the moist tongue with the intense thirst. Urinary symptoms. The quantity of urine voided is comparatively larger than the amount of the fluid intake. So if the patient drinks less quantity, if he's intaking 1 or 1.5 of liters of water, 1 to 1.5 of liters of water, but he is visiting the restroom for about 10 times a day or 12 times a day, it is somewhat abnormal because the intake is just 1 or 1.5 liters, but he's visiting the washroom 10 times. So there is some, it's not tallying. There is some incompatibility here. There is some problem. The quantity of urine voided is comparatively larger than the fluid intake. Frequent urging to urinate, even every 10 minutes the patient has an urge to urinate. Especially at night, nocturia is present in Mercosol. The patient has a disturbed sleep because of passing the urine every 10 minutes. But only a little quantity is passing out at a time. Even though the patient is visiting the toilet many times, the quantity of the urine is less. Urine is very offensive. There is burning sensation in the urethra during the passing urine, and also after the micturition there is burning sensation in the urethra. Leukorrhea. The leukorrhea is greenish, biting, acrid. Fetid leukorrhea, greenish, biting, acrid, and fetid leukorrhea with much scratching. The patient has much scratching. So we see it is acrid, so it is biting as well. Okay, acrid, biting, fetid leukorrhea. There is scratching, aggravating, especially at night. There is burning after the scratching. Rawness is seen. Obviously, after you scratch, there is rawness of the part. So, especially at night, after the scratching, there is violent burning and rawness in the area. Aggravated from the contact of urine, and it is relieved by washing the part with the cold water. Mammae are painful, very painful in fact. as they would ulcerate, as if the mamma is ulcerated. They are very painful at every menstrual period. Conium, lacanum are very painful. These are the other remedies where the mammae are very painful. Milk in the breast is seen instead of menses. Like we have vicarious menstruation, like nosebleed instead of menses. Similarly, here they have milk in the breast instead of menses. Mercsol has milk in the breast instead of menses. Moving further to the skin symptoms of Mercsol, every little injury suppurates. What are the other remedies? Hepar, silicea, graphitis. Persistent dryness of the skin is contradicting Mercurius. So, if there is dry skin, we should not think of giving Mercurius to the patient. In boils, abscesses, when the suppuration is set in with the intense pain at night, you can see the boils, abscesses, wherein the suppuration has already set in with the intense pain occurring at night. The itching is worst from the warmth of the bed at night. Vesicular and pustular eruptions are also observed. Moving further to the ulcers, and we have this irregular ulcers in cases of Mercsol, because the edges are going to be torn, the margins are everted like a raw meat, the base will be covered with a caseous coat. So we see the ulcers are in an irregular shape with an undefined edges. The edges are undefined. Can you define the edges? No, the edge of the ulcer is undefined. They have this undefined edges. Margins are everted like a raw meat. You can see very beautifully in the picture here the everted margins of an ulcer. The margins of the ulcer are everted. They are everted. They are turned outwards, everted, like that of a raw meat. And the base is covered with, so we see the base is covered with a caseous coat. What do you mean by caseous coat? Cheesy, okay, cheesy, yellowish cheesy coat. They have a dirty, unhealthy looking skin. The large ulcers which bleed easily when they are touched. Tendency for the ulcers to run together. They have the tendency for the ulcers to run together. Rapidly decomposing ulcers on the legs. On the legs, they have these ulcers which are rapidly decomposing ulcers as seen on the legs, and the pain is worst. The pain is worst at night. Okay, they have this rapidly decomposing ulcer in the leg, rapidly decomposing ulcers on the leg, and the pains will be worst at night. The modalities, by now we are very familiar with the modalities. The complaints are aggravated at night, damp, wet weather, when the patient is lying on the right side. The perspiration, the natural discharge is bringing no relief to the patient. In fact, it is worsening the complaints. The warm room and the warmth of the bed. It is ameliorated by rest and weeping. Okay, the complaints are ameliorated by rest and weeping. Thank you. With this, we come to an end of the video. If you like this session, hit the like button and subscribe.